Hello everyone, welcome to Here We Know How. Today we will discuss about how to protect yourself and your family from coronavirus COVID-19. With the recent coronavirus outbreak, you are probably worried, especially if there are confirmed cases near you. You can take actions like staying home whenever possible, washing your hands, performing exercise or yoga every day, and look after your health. Here are some methods you can apply to your life, helping yourself and your family in this outbreak. Let's begin. Number 1. Stay home as much as possible. You have probably heard about social distancing, which help limit the spread of virus. Only leave your home for necessities, like restocking groceries. Don't go out to eat or watch movies. If everyone follows social distancing, the virus won't spread easily. Don't meet up with friends or family at public place. It's best to have a meeting on an online platform, like Skype and Google Meet. If someone in your family is 65 or older, having compromised immune system, lie in high-risk group, better take care of their health. Number 2. Stay away from people who are coughing or sneezing. Since corona is a respiratory infection, coughing and sneezing are common symptoms. Additionally, coughing and sneezing both release virus into air, that leads to increase in risk of infection. Keep your distance from people who appear to have such symptoms. If you find someone coughing, ask the person to stay away and maintain a safe distance. If you find someone that has been around sick people, it's a good idea to distance yourself from them too, as a precaution. Number 3. Wash your hands with soap and water to minimize risk. Best way to prevent from coronavirus is to wash your hands as often as possible for at least 20 to 30 seconds. Wet your hands with warm water, then apply a mild soap. World Health Organization, that is, WHO, recommends not just rubbing your hands palm to palm, but interlocking your fingers to ensure every surface is clean. Always wash your hands before you eat or drink anything. It's also best to wash your hands anytime in public or when you are around someone sick. If you can't wash your hands, use a hand sanitizer that contains 60 to 95% alcohol. Note: alcohol percentage higher than 95% are actually less effective. Number 4. Keep your hands away from eyes, nose, and mouth. You may come into contact with coronavirus on a surface that can easily infect you if you touch your face with those hands. If in case you need to touch your face, wash your hands first, so you are less likely to infect yourself. Most importantly, cover your mouth and nose when you sneeze or cough, using tissue paper. If you don't have one, use your sleeve instead of hands. Number 5. Don't shake hands with people, whether they show symptoms or not. There may be people infected with coronavirus but aren't showing symptoms. So, it's better to limit personal contact to help prevent the spread of coronavirus. Number 6. Disinfect high-touch surfaces daily. Coronavirus linger on surfaces, such as doorknobs and faucets. Use disinfectant or bleach to clean these surfaces daily. This limits risk of virus lingering on surfaces. In cases, you can make disinfectant by mixing 1 cup bleach and 1 gallon warm water. Number 7. Avoid unconfirmed rumors. Myths about coronavirus have spread on social media, causes unnecessary fear. Must get the facts from reliable sources like WHO and Arogya Setu app. WHO denies that there are special foods that prevent COVID-19. Number 8. Watch for updates from trustworthy organizations. Organizations like WHO constantly updates their pages to provide information about COVID-19 and how to prevent it. Paying close attention to these updates may help you take more additional steps to secure yourself and your family. If you are able to help, you can donate to these organizations so that they can help the needy people. Getting updates by watching news is a better way to get knowledge about the relief provided by the government in your local areas. Number 9. Maintain a distance of 6 feet. In case you need to leave your home to shop outside for groceries, performing exercise, or get fresh air, you may take a walk, but be sure you don't get too close to people. It's better to remind others to maintain a safe distance to make sure you and others stay safe as well. Number 10. Wear a cloth mask when in public. It's recommended to wear a mask, or at least cover your nose and mouth in public. But remember, face masks shouldn't be considered a replacement for social distancing. If you are unable to buy one, you can just sew cloth mask yourself, or use cloth to cover nose and mouth properly. Note, mask helps to prevent transmission of virus from carriers who have no symptoms. Number 11. Wear disposable protective gear while providing care. You may put disposable gloves and a face mask before you care for a sick person. Also, take off your gears and throw them in trash bin before you leave their room. Don't reuse your protective clothing, as coronavirus may linger on your clothing, and you may get infected accidentally. Number 12. Don't share household items. There's a probability coronavirus may linger on the items like cups, plates and other utensils that you share with other people. Be safe. Wash the item before you use it, or get another one. Number 13. Wash all laundry with warm water. Laundry materials, like bed sheets and towels, can hold coronavirus. So, it's important to wash them thoroughly. If it's safe for your fabrics, add some bleach to sanitize the laundry. Number 14. Cook meat and egg thoroughly. There's no clear evidence about coronavirus transmission from animals to humans, but it makes sense to treat animal products with care. It's important to cook them thoroughly, to kill any germs present. Number 15. Limit contact with live animals. Avoid handling live animals unless you work with animals or are caring for pets. You must touch an animal as little as possible if it isn't your pet. Wash your hands after handling live animals. Additionally, wash hands between handling multiple animals if any one of them is ill. This way you won't accidentally infect other animals. Number 16. Call your doctor or health department. If you are having fever, cough and shortness of breath, stay at home and contact to doctor or health department to ask about coronavirus test. Only visit if the doctor thinks you need to be tested for coronavirus. If you go into doctor's office, be sure to wear a face mask to prevent spreading infection. But it's important to seek medical attention if you develop serious symptoms. You can apply these methods in your life, helping yourself and your family in this outbreak. Here is the summary of methods mentioned. Stay home as much as possible. Stay away from people who are coughing or sneezing. Wash your hands with soap and water to minimize risk. Keep your hands away from eyes, nose and mouth. Don't shake hands with people, whether they show symptoms or not. Disinfect high-touch surfaces daily. Avoid unconfirmed rumors. Watch for updates from trustworthy organizations. Maintain a distance of 6 feet. Wear a cloth mask when in public. Wear disposable protective gears while providing care. Don't share household items. Wash all laundry with warm water. Cook meat and egg thoroughly. Limit contact with live animals. Call your doctor or health department. Thank you for being here. Hope it was helpful, and you would like, comment and share our video. And don't forget to subscribe our channel. Here we know how.